Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the consumer. And today we have an interesting topic, something that you may not have thought about before in relation to healthcare reform. We're going to be having a return guest with us, Dr. Tamara Kerr from Villanova University. And I will be introducing Tamara again in a moment. But I want to tell you the title of our show today. It's called Real People as Professors, Turning the Tables in Educating Tomorrow's Nurses. Now, when we think about healthcare reform, we're usually thinking about what's in it for me. I mean, how healthcare reform is going to change how I have access to care, the insurance changes, etc. But if you're Tamara Kerr and many other nursing professors across the country, they're thinking about how do we have to educate nurses for the future? What is going to be different? What are they going to need to know given all of these reforms? And that's what Tamara is going to be talking with us today about. So the 3 things that we are going to be covering is a topic that we have talked about in other shows is how healthcare reform is really emphasizing patient-centered care, you as the patient. But in this case, we're going to be talking about how patient-centered care has to be translated for nursing students. So that the way Tamara is going to be telling us they are doing it at Villanova is they're bringing real consumers, real people into the classroom and into the laboratory. And I think that's very exciting, and she's going to tell you about how that works. She's also going to be talking about mobile technology and how that will influence how care is delivered and how you become more of a partner in that care. And then finally, we're going to be looking at what's in the pipeline. And she is working as a researcher with a Boston-based company called Patients Like Me. It sounds very exciting, and I'm really interested in learning about this along with you. So again, I want to say our title is Real People as Professors, Turning the Tables and Educating Tomorrow's Nurses, and to welcome you, Tamara, again to our table.
Thank you. I'm delighted to be here again. I'm delighted to talk about nursing education.
That's wonderful. And Tamara is a very well-educated nurse herself. She is a professor of nursing at Villanova University. She has a degree herself from Gwynedd Mercy College, her master's degree from Thomas Jefferson University, and a PhD from Villanova University. So Tamara is an excellent person to be educating our nurses of tomorrow and being with us today. So Tamara, tell us what your life is like as a professor. What are you doing with these students, and how did you and the whole faculty as a team come together to really restructure the educational process?
Absolutely. So at Villanova, we're going through a curricular change. And as we go through this curriculum change, we noted that healthcare is changing around us, and it's changing at a very rapid pace. And no doubt, the focus is and has always been on patient-centered care. Although in 2014, I believe the focus on patient-centered care is greater than it's ever been. It's not a buzzword. It's not something we say we do and kind of half do. And so as we went through the curriculum revision process, one of the things we knew we needed to do is to put patients at the center of the nursing process in relationship to education.
Now let me just ask you about that a little bit, because I think a lot of people, other nurses, as well as other listeners who are not nurses, would say, hasn't it always been patient-centered? What's different about this?
And it has always been patient-centered, but I think when you come down to the bottom line, many times we would go in as nurses, and we can say this for any healthcare professional, and say, this is what you need to do. This is what you're supposed to be doing. And many times we did not ask for input from the patient, the consumer, about what they're really doing. So the focus is really engaging that patient as a partner in the healthcare process at a higher level than we've ever done before.
That is very interesting.
And I think with the Affordable Care Act, we have engaged patient partners because they're going to be making choices about their health care. They're going to be making choices about their insurance plans. And so they're probably a more engaged consumer than we've had in prior decades.
Right. I'd like to just emphasize a couple points that Tamara's already made. She also said that it's not just the nurses that are going through this change process. It really is across all disciplines. In fact, in a recent segment on one of the morning news shows, they were featuring a medical school where they had the medical student going out to the community and partnering for many months. I believe it was with an Alzheimer's patient, and getting to know that patient and really understanding what it was like to live with that illness. And they were interviewing this young resident intern physician, and they were saying, what was it like for you? Because physicians are very transactional in hospitals. They're really learning the craft of medicine, and getting really deeply involved with patients is sometimes a secondary item. And obviously that curriculum was trying to emphasize more of a patient-centered approach as well. And the young physician was saying, this was great. I really never understood this before. So I think what you're doing in nursing is really spilling over into medical education as well, which I think is really wonderful.
Absolutely. And one of the other initiatives that we've gone forth with at Villanova is bringing that patient into our classroom. And you can say, well, that's probably always been done in nursing. We have guest speakers who come in, maybe they've had a spinal cord injury, or their child is dealing with a chronic illness. Well, we're actually doing it in a little bit of a different way. These are not just guest speakers, but they're coming in as what we would call a standardized patient, a patient who's working with us in a simulation or laboratory setting where we are allowing our students to actually now one-on-one work with these individuals who are dealing with a chronic illness or a disability, so that they gain firsthand from the patient what it really is like to care for this patient, but also more importantly, to live with this illness or disability.
I see. And can you give us an example of that?
Yeah, so the example is, again, we have individuals who have physical disabilities who come into our simulation setting, and the nurses are actually working with these patients and transferring these patients, interviewing these patients, assessing the patients. So it's a real life situation that our students may actually not be able to achieve in a clinical setting for a short period of time. And so instead of sending our students, to our patients, the patients are actually coming to our students.
That's very good.
And again, they're the experts. I see this patient living with the disability or the chronic illness as an expert, and now they have direct contact with our students.
I think that what I want to just be sure you all understand is that when Tamara says a simulated setting, she's talking about a lab, and they do have an exquisite simulated center at Villanova that was opened just a few years ago. And it is really set up to look and be exactly like a patient care setting in a hospital, correct?
That is absolutely correct.
So all the equipment, the beds, and I think the other point that you made that a lot of people might not understand is this idea of a standardized patient, which from a teaching point of view is very important, because as students are brought into the clinical setting, where they are in an actual hospital, they are assigned to random patients. I mean, it has to do with the patients that are there in any particular period of time, and it has to do with what their emphasis is in their curriculum at that point. So they don't get a standardized patient because each person's different. But I think in teaching this model, by standardizing, everyone understands exactly what you do for someone with a heart disease, exactly what you would do with someone with diabetes, so that by standardizing that, when the students go in to work with real patients, meaning the people that they meet in a real hospital or a clinic, they can transfer that knowledge over from that standardized patient experience.
And you're absolutely correct. It allows us to be more deliberate in our nursing education in the experiences that we set up for our students. And again, bringing these individuals in who have chronic illness and disabilities allows us not to work with mannequins or electronic technology, but to actually work with these individuals who can share their expertise and wealth of knowledge in living, working, and managing this health condition.
Well, like that medical student I was referencing that I saw on a TV channel, how about the students? How are they responding to this?
So absolutely, the students, without a doubt, are responding very well to the standardized patients and the actual individuals who are coming into our setting. We're very early in the process, but the feedback has been very positive from the students and the outcomes of their learning.
Okay, so how do you recruit these real consumer professors? How do you find them, and what's the experience like for them?
So they're found because we have a number of faculty at Villanova who work with chronic illness and disability as their specialty. So they work through channels, connections, and organizations that they have contact with to bring these individuals into our environment. And in some ways, it's kind of haphazard as to how we come across these individuals.
Right. So there's no agency for being a consumer professor.
No, unfortunately, there's not. Although it might be an innovative area in the future that someone could develop this as a business pitch, possibly.
I see. That's interesting. And tell us about the people that are actually doing this. What is their experience like?
I wish I could say I knew, and maybe that's and the next channel that we need to kind of look into what their experience is like as an individual who's actually doing the acting, and it's not really acting, they're being themselves in this environment. And so I have to honestly say I can't answer that question as to what the experience is like for them, but it possibly is something we absolutely need to look into.
I would think it would be very interesting for people to do that.
And I think it would also be, they feel like they actually have a first-hand role in education, because these are our future healthcare providers who they are educating on the front lines, and we know what happens in those first 4 formative years of nursing education is going to impact these students ongoing. So I would imagine it's very, very, it has a feeling of freedom and power for these individuals because they're on the front lines of nursing education.
Right. So I think from a consumer perspective, it's very interesting to learn about this shift in educational emphasis and how they are using at Villanova, and no doubt probably in other organizations across the country that are educating nurses, physicians, other clinicians, are bringing the real clients to the table in a very organized way. But I'm wondering, what will consumers see? I mean, these are the nurses in the pipeline. They're not going to be graduating, necessarily this year or next year, but they're coming along. Right. What do you think that the consumer is going to see that might be considered different?
So obviously, because we're putting the patient at the front of the healthcare arena and the education arena, I think that the nurses that you're going to see of the future are hopefully going to be more compassionate. They're going to have been exposed to the stories of these individuals as to what their experience is like living with this illness, living with the chronicity of a specific condition. And so they will hopefully have empathy and understanding. You can read a story in a book, you can see a program on TV, but having that real life one-to-one contact and communication, no doubt, is going to shape how they think about this. And it actually brings me back to research that I did during my doctoral work at Villanova, which focused on transformative learning. And I actually asked this question to students: what transformed your learning during nursing education? And almost 100% of the time, through the stories that the students told me, it came back to not the book, not the mannequin. It came back to human life experiences that they had in and out of the clinical setting.
That's beautiful.
And we're getting to that by bringing these patients to us.
Right. And I think the point to emphasize for those who are listening is that when you are a student in any of these practice fields, when you get into the clinical setting, everything is very fast-paced, and it's also, you're doing things. You're inserting an IV, you're giving out medication, you're charting, you're checking, you're making rounds. It's often very hard to have those personal conversations with people. And I think that is what Tamara is saying, is recognize that that's missing.
Correct.
And this is a way of addressing that. And we're not talking about long conversations, because very little time in these clinical settings, but meaningful interactions. It can only take a moment. It can, asking that right question, listening to what the patient has to say rather than just bustling off out the door. It's very hard to really get that across. It's not because nurses don't want to do it. They're very pressured in most clinical settings to get a lot done in a shift. But I'm glad that you're helping them realize that they really have to balance this.
Absolutely, and I think we all agree as educators, whether it's in nursing or regardless of the healthcare profession you're in, we can teach a student a skill. We can teach anyone a skill. But to teach a nurse in their early years to be caring, compassionate, is something that takes time. And this process is one step in helping the students develop those caring skills.
Right. I think that's wonderful. Tell us about what's in the pipeline. Tell us about this company you're working with in Boston.
Absolutely. So not just in nursing education, but when we look at education of all health professions, we really see this focus on patient-centered care. And I've had the opportunity over the last 6 months to be involved as a researcher with a company called Patients Like Me, which, as you said, is based out of Boston. And Patients Like Me essentially puts patients through a social media platform at the center of education, information sharing, and research.
Okay.
And essentially, patients, individuals, like any of us, can go on to Patients Like Me and we can become a user. And we can connect with patients who have conditions such as high blood pressure, asthma, cancer, a number of chronic conditions primarily. And you can share your experience with other patients. And again, it brings us back to that core that the patients are really the experts living with these conditions. It's not the healthcare provider who learns about them in a book or in a classroom setting. And so we are seeking out the patients' reported outcomes, their stories, and their experiences. But more importantly, we're connecting patients together that share a similar health condition so that they can work to support each other.
That sounds like it's very, excuse me, very needed. So tell us about your research with them. How are you're obviously setting up areas that people can access online, but what is the research part of this?
Absolutely. So as I said, there's an information side of Patients Like Me where they share information about certain health conditions. There's a side that connects patients to research studies that are happening at a number of universities and institutions throughout the world, because this is an international platform. It's not just a domestic American platform. And then the third component is the research component. And it's an open research exchange, which again is a novel approach, which means that patients with self-identified conditions can actually be part of research studies. So I'm developing a tool that looks at patients' management and barriers to managing high blood pressure in the home environment.
Okay, tell us the details of that.
Absolutely. So I'm able to send invitations to patients who've self-identified as having high blood pressure, and I've developed a 70 item or 70 question tool, and we actually put that tool out to several thousand individuals during the month of October, just a few weeks ago. And the patients can answer the questions, or they do answer the questions, and the data comes back. And again, firsthand, we're hearing about the problems that the patients may experience in managing high blood pressure. Approximately 35% of the American population and international population have high blood pressure. And it goes on and can be a very serious health concern related to kidneys, heart, so on and so forth, basically every organ in the body. And we know that some patients have challenges in managing their high blood pressure. And so this tool asks the questions, what challenges and where do those challenges exist in managing your high blood pressure? Many times when patients come into the office, we may be very quick to say, you have high blood pressure, let's give you another medication, let's increase your medication. But maybe we don't ask the questions, are you really taking your medications? Can you get your medications? Can you afford them? Can you get to the pharmacy? And so this tool asks those questions. It drills down to some very essential questions to even see how the patients are managing high blood pressure. It's one of several studies that Patients Like Me they're actually doing right now, not related to just high blood pressure, but a number of different health conditions.
It sounds very interesting. As a startup company, I guess they're growing other areas of interest, and then they will have in time a whole menu of different possibilities that people could access.
Absolutely, and that actually increases on a daily basis. And when a person goes on to Patients Like Me, they can actually see the health conditions kind of categorized by heart conditions, lung conditions, and then they can actually look at those conditions that are represented, and they can join those discussion groups and they can share their experiences. And as a researcher, it's very interesting and important to go on and to see these discussions that are happening, because what we think think as healthcare providers is important. What I found in the 6 months in working with patients like me, it's not what's important from the patient perspective. And so we hear the patient's perspective, and now we can bring that into the healthcare arena.
That is really very important. That's really all part of this patient-centered care approach that we've been talking about in many of our shows as a theme, really being generated by a lot of the discussions around healthcare reform, because it's believed that the more engagement we have of you, the consumer, the family, the community, the better care will be, the better job that we can do to deliver care. So it's not a question of just sort of dumping the responsibility back onto the client, the family. It's really engaging, having you work with us and we work with you. It's not a one-way street, we just working with you and then you being the recipient, but again, as Tamara is saying, not always understanding what to do or being able to mount all those barriers that you have to really struggle through in order to get the care to really work for you. So give us an example of what you said. When people go online to this Patients Like Me site and they fill out a questionnaire around their disease condition, and you can see as the researcher or as anyone that is involved with that company, here's the barrier that this person is up against. Does the site address those barriers? I mean, do they help the person figure out how to get on a better track?
That's an excellent question. And as researchers, and there's a small pool of researchers on Patients Like Me, you have to be accepted to become a Patients Like Me researcher. And I was one of the first 4 selected to use this platform and the only nurse who was selected. But nonetheless, we are all developing tools. We're developing measures that can be used in hospitals, doctors' offices, the home care setting, so that healthcare providers can use these tools to identify the barriers. The other piece of Patients Like Me is the tools that we're developing are going to be free of charge. Providers, healthcare providers, physicians, doctors, nurses, nurse practitioners, they're not going to have to pay to use these tools. And all of the research behind the tool development will be completed by the group of researchers that are working with Patients Like Me. So by using the tool, individuals will have the ability to gain that information for the populations that they're caring for.
I see. Well, so it really works not just for consumers directly, but it also for healthcare providers. They can use this as well.
Correct. And one of the first steps, again, which is a novel approach, because many times as a researcher, we can become very self-absorbed in getting the data for our study and publishing the data so that we can achieve whatever it is that we wish to achieve in our academic or medical setting. With Patients Like Me, their first approach is not to get the data out there to other healthcare providers, but my first step is to share the data with the patients who participated in answering these questions, to inform those individuals. This is what we found when we conducted this survey. These were the trends. So that's the process. That's where I actually am right now in writing up the data for the patients to inform and teach the patients, and then we'll put the tool out there for other healthcare providers.
Right. So it sounds like this is a good example of engagement in just really developing a tool. So if you're involved with this, you're really part of the process, whether you're a research subject or not involved with the actual research angle. Just using it and being involved sounds like it's a great partnership right there.
You're absolutely correct. And in developing the questions, not only did I develop the questions, but I worked with a pool of individuals with high blood pressure to test the questions to make sure that I was asking the right questions that were important to these patients.
And how about the part where consumers can talk to other like consumers with the same condition?
Absolutely.
How does that work?
So basically it works very much, if anyone has been involved on Facebook, it works very much in the same way. They can go into their forum, and let's say they want to talk about idiopathic pulmonary fibrosis. They can go into that forum, they can post a question, they can share a research study, they can answer another individual's question, and the threads or the links continue and other individuals can come on to that forum. They can read the information, they can choose to reply to the information, so it's all put out there. And it's monitored by Patients Like Me. And the patients know when they sign up to become part of this social media platform that we consider it an open exchange, that information is put out in a very social media-like fashion.
That's great. So you're saying the monitoring. I think this is really important because in other programs we've talked about websites, and you really have to be on the right websites. I mean, there is a lot of health information that you can find on the web that is very good, but there's also some sites that really are giving you not the clear facts, or maybe steering you in a direction that may not be really the best one. So when you're saying about oversight, is that oversight around making sure that the information is scientific, it is correct?
To some degree, because we're not going to limit what patients choose to share amongst themselves, but we will. I can't say we. Patients like me does monitor that the discussions are going in the correct direction. There are a number of groups that consult and actually partner with patients like me. They don't really have any monitoring responsibility, but it is a relatively open forum for the patients to share what they want to share. And I do have to say, on patients like me, sometimes the information that's shared is not as scientific as we would like it to be as physicians and nurses, but I also have been privy to conversations in waiting rooms where patients are talking to other patients, and that's not as scientific. So I kind of think of patients like me as kind of like a waiting room type of exchange in a social media platform.
That's interesting. So having been really involved with this sort of deep work with this particular company, with this particular platform, what are your predictions for the future? How do you think this is really going to impact care? Not just this, but your work at Villanova with the students. Where do you see healthcare going in the future?
Absolutely. Well, there's no doubt that we're going to see more and more patients coming to the center of care. And I think the other piece that we've seen as an educator, I've noticed that sometimes the patients are really leading us along. They are using not only tools like Patients Like Me, but they're using a number of other tools. They're using mobile apps to check and monitor their blood pressure, their blood sugars, their weight, their nutritional intake. And they're doing these things in the home environment. And so it is important to us as educators that we now bring these tools into the classroom, and we start using them in the classroom, the clinical, and the laboratory setting, so that our students are able to work with these tools, because the patients are already doing them, and they're teaching us how they're using these tools. Right.
I mean, seriously, the nurses, the physicians, other healthcare providers are really going to have to be up to speed with all this.
And it's happening very, very quickly. And again, the good news about our younger generation of students coming through is they're very adept at social media. They know how to work with and use their smartphone, and so it's in many ways coming natural to them, but we need to incorporate that into our educational settings as well.
That is wonderful. Well, it sounds like there's a lot in store for all of us as healthcare consumers, and I think that the ramp up for this is to get involved, to go on the web and to really see the sites that are out there, and to sort of shop around and see what really is going to work for you. What I like about what Tamara has talked about is the social interaction. One of the things that, again, we have really emphasized in many of these shows is that when you are involved with a chronic illness, meaning an illness that lasts over many years, it can be very isolating. And it's so important that you start to learn more about your problems and how to deal with them by talking with other people that are also going through many of those same issues. So this is really a great heads up on way this is getting organized, so that really it makes it much more accessible to you. We had another program on the Oral Cancer Foundation and how wonderful they are in helping to facilitate these kinds of connections. And it can be a lifesaver when you're sitting at home, either as the patient or as the care provider. So I really love the idea that we're breaking down those walls of isolation. And people like Tamara Care and others are working together to be sure that the healthcare delivery system of the future is enhanced by all this technology and by the orientation of the people that are really right at the bedside, the nurses and the physicians, to really help you take care of yourself in a much better way so that you can have a healthy and happy life. I want to thank you, Tamara, for being with us. You're a wonderful guest. It's just been a pleasure to have you again. And I want to thank you, our viewers and listeners, for joining us. Thanks, and have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.